Welcome to Healthcare Unbound, a podcast powered by Clarify Health, where healthcare's changemakers discuss ways to advance care outcomes, costs, and affordability.
Welcome to Healthcare Unbound, powered by Clarify Health. I'm Jean Drouin, CEO and co-founder of Clarify, and it's a pleasure to be here with you today and with Saul Marquez from Outcomes Rocket for our conversations about advancing the business of healthcare. Saul, such a pleasure to be here with you.
John, it is such a pleasure to be here with you too. You know, for those that may not know, John and I have done a few podcasts together already. And this was sort of like the natural next step is that, okay, we sort of did two podcasts together. What's next? Healthcare Unbound is what's next.
I'm so glad that we managed to finally make this happen, Saul, and really excited about what we're going to do here together. And really, I was moved by your description to me of Outcomes Rocket and the moonshot that you're wanting to help the industry achieve here through the conversations that you've been curating. And it harkened for me back to the whole reason for starting Clarify 8 years ago with my co-founder, Todd Gatula, who came from the financial services industry. And we came together around the purpose of building an enterprise analytics company. Well, even it was more fundamental than that. It was bringing together the power of data to be able to allow those that work the magic in healthcare, the physicians and the families who deliver the care, the life sciences companies who develop the therapies, the payers who administratively make this possible, the employers who, in part, and the government who pay for it. And to empower all of those actors with far more timely and actionable insights to ultimately personalize journeys and deliver the better outcomes in a more delightful way, in the way in which we all want. And I think one of the things that we've learned over the past several years is just how hard it is to scale good ideas and good concepts in healthcare. And so when you mentioned creating a forum where we could have conversations that matter and help to exchange information, not just on the different forces shaping healthcare, but also on how to scale and innovate. It's more than just a light bulb that went on for me. I was like, wow, this could be a lot of fun. And it's just so great to have someone like you who's so passionate about creating spaces for conversations for us to come together and hopefully offer a helpful vessel for people to come and help us have those conversations.
Yeah, John, you know, I love that. And I've always been inspired by the work that you and the Clarify Health team have been up to. What we need is insights, and we need insights that are going to drive the future health system that's value-based and not just transactional, that is about health and not just sick care. And so to have these types of conversations, I agree with you. We're going to be offering insights to people that they'll be able to take and apply right away. But also, we're creating relationships because at the end of the day, I think of podcasting almost like if you meet somebody and you have a beer with them or a coffee with them.
Yeah.
Like when you have a podcast with somebody, it's that same feeling, right? You're like, oh, wow, you just got to know that person a little bit better. And when people tune into our podcast, they're going to get to know us and our guests a little bit better, which we have some exciting guests coming up. I don't know if you want to preview some of the guests that we have coming up, Jean.
Well, look, absolutely. I mean, we're kicking off with Dr. Amol Navathe, followed up by Dr. Zeke Emanuel, who together were the co-founders of Embedded Health and have come up with really exciting new micro incentive-based payment models to help physicians and reward them in making the right decisions and delivering better care. And it's a bit of an indicator of the kinds of topics that we're going to be excited to deal with on this podcast and in these conversations. So the role of behavioral economics and the application of it to healthcare and how that helps us to create new incentive programs, how it is that we bring the power of big data and what's been learned on that front from outside of healthcare and enable healthcare to move from insight to better decisions far more quickly. There's been the explosion of generative AI. So how is that going to manifest itself in healthcare? How does that change the value of data relative to even where we were a couple of months ago? And ultimately, all this is fundamentally about is how do we help curate the conversations that help provide all of those out there who want to make a difference in healthcare to be able to more easily scale what it is that they're doing. So hopefully there'll be a little dose of insight and inspiration that helps all of us collectively to move the ball forward in an industry where it's easy to have a sense that we're getting stuck. And yet there's so much good that is to be had if we all come together in the right way.
Couldn't agree with you more, John. And one of the inspirations, and really, as you guys are watching and listening to this podcast, one of the inspirations from Jean was we need to pipe in content that's from outside of the industry to really scale the efforts of healthcare. And so it's going to be exciting to bring in conversations from not only multi-stakeholder representatives of our healthcare system, but also other industries. Like your co-founder, Jean, came from finance, right? The finance industry.
Yeah, absolutely. Todd, well, it's funny. We didn't know each other. We were introduced by a mutual friend. And I have to say that these kinds of collisions between those from healthcare and from outside of healthcare can be incredibly powerful because we've had the gift from Todd and his team of bringing, we can nerd out for a second on this, is they had built the platforms in the cloud that enabled the big banks and hedge funds to, in real time, calculate across equities, bonds, derivatives, what the value of any portfolio is at any given time. And what's really interesting there is the ledgers that they had to use are exactly the groupers that we need to use in healthcare to, in the moment, understand patient journeys and be able to give clinicians real-time insights as to what to do. And funnily enough, the approach taking in banking as applied to healthcare was a leap forward in terms of being able to harness the power of the healthcare data that's now coming together. And there's many other examples like this and many more to come with AI, ML, and the like. So I think what you'll find is that by having this focus on conversations around how to scale and conversations around how to open our thinking to new approaches, hopefully we can accelerate the adoption of ideas and concepts that can make a real difference in this industry. You know, and ultimately help all of those who are out there fighting day in and day out to deliver more of the quintuple aim.
Yeah, couldn't agree more, John. And look, guys, we'll be coming at you twice a month with fresh episodes with amazing leaders and change makers in healthcare. We're super excited to not only have this conversation, but open up the conversation for you to join in it. We'll be posting them on LinkedIn so that you could jot your comments down. Let us know what you think, because at the end, we want to know what you want to hear about. If something resonated, if you didn't like something, we want this to be an exchange, not just us saying things and inviting people to say things at you. We want you to exchange ideas with us. So definitely excited to be doing this with you, Jean, and looking forward to the podcast series.
Absolutely. And coming back to the title of this, Healthcare Unbound, why? Ultimately, let's free ourselves by coming together in inspiring conversations to be able to scale this industry to the outcomes that we all want. So really excited, Saul, to partner with you on this and with all of our listeners and viewers, as well as those who'll be on the podcast. And I make an invitation right now to all of those that are out there listening to both interact with us and send us feedback, and also send us suggestions of who you'd love to hear converse with us as we move through future episodes. So really looking forward to it. Thank you, Saul.
Thanks, John. See you all soon.
Thank you for listening to Healthcare Unbound. We hope today's episode was insightful. If you want more information on how Clarify Health can help you, please visit clarifyhealth.com.